Welcome back onto our other big focus now. COVID is not over. That is the message that doctors, health experts and medical bodies around the country have been at pains to send out. Even as a sense of complacency coupled with COVID fatigue set in, let's not lose sight of the fact that COVID cases have seen a definite upward trend across India over the last few days. On Thursday, India officially recorded almost 2,500 COVID cases. There has been an uptick in the numbers in states like Delhi and Tamil Nadu in particular. In fact, IIT Madras has been declared a COVID cluster after at least 30 cases were reported there. The mask mandate in most states is back. Violations will invite penalties, and even as we yearn to return to normal life, we simply cannot afford to be reckless with this virus. Not only have people stopped adhering to COVID protocols, there has been a massive dip even in the vaccination figures. Serum Institute of India, the world's largest vaccine manufacturer, says it has stopped making fresh COVID vaccines after its stock went up to 200 million doses with few takers. The CEO, Adar Poonawalla, has said he even offered to give free donations to anyone who wanted these vaccines before they expired. Poonawalla, in fact, has warned people against returning to the business-as-usual approach, saying we cannot afford to put a price tag on the life of a citizen as the pandemic is far from over. In fact, he's been urging the centre to also lower the gap between the second and third vaccine doses from 9 months to 6 months to ensure that India never has to experience again what it did in the summer of 2021 during the horrific second COVID wave. So we're asking, is it time for us to shed our complacency, mask up again and start taking COVID seriously? Let's put those questions to our panelists. Joining me on the show tonight, Dr. Sunila Garg, member of the Lancet COVID-19 Commission and an advisor to the Indian Council of Medical Research, Dr. Harsh Mahajan, founder and chief radiologist at Mahajan Imaging, and completing the panel, Dr. Sameer Gupta, co-chair, healthcare PhD, Chamber of Commerce and director, cardiac cath lab, Metro Group of Hospitals. Warm welcome to all of you for joining us. Dr. Sunila Garg, let me start with you. Let's first look at the uptick in the COVID numbers that we've seen in the last few days, including here in the national capital. In just a few days, the mask mandate, as I said, is back. Penalties have been reintroduced. Do you believe too much complacency has set in? People have stopped taking COVID seriously, and that we need to now be somewhat concerned. How would you look at the present situation and the numbers that seem to be going up?
Thank you, Neha, first of all, for having me on the show. And I hope I am audible very clearly.
Yes, ma'am. Absolutely. Please go ahead.
Yeah. So it's very, very important that when these, disaster management authority had lifted the, protocols, I will like to say at that point of time also, it was not clearly mentioned at that point of time that, people have to kind of comply with the COVID appropriate behavior. People took it as, this thing that, the pandemic has gone, the number of cases are low, so we can do away with COVID appropriate behavior. But the thing which was conveyed, always was that virus is still amongst us. We are getting occasional cases, but definitely the cases are there. But, this does not mean, this did not mean that, basically the number of cases, will not come up. And at the same time, primarily we also saw that the schools opened up, and also there was complacency at that point of time also, along with, giving up of the COVID appropriate behavior, the protocols in the school also, they were also got to be really ensured. So these are some of the important things which I will like to say, that if we have to, take care of the virus, we have to first see that and keep in mind that virus has not gone out of our lives, number one. Number two is that we are still having cases which are there due to BA 12.1, that is number one. And we are seeing also a large number of cases which are there because of BA.2. These are all Omicron variants. There is, we don't have to panic, but the question is we can't be losing, our precautions, and we have to follow this whole thing, a COVID appropriate behavior along with genomic sequencing. The third is also we have to do smart surveillance as well. Because if you talk to people that basically those who have turned out to be positive, how many are being regularly contacted? That is also another point of time, another point of concern, that whether people who are coming out to be positive, are they being monitored regularly? or we are following them regularly? These are some of the important concerns in our mind from a public health perspective. And definitely another important thing is with regard to vaccination, because when we went to 186 crores to 187 crores, now this is where also we don't have to lose a sight of our vaccination also. And since the precautionary doses have also been opened, so people should come, and now they're available free of cost on the government facilities as well. So that is where we need to focus on, I'll say three things: COVID appropriate behavior, genomic sequencing, smart surveillance, and overarching is vaccination.
Well, so as they say, it should be back to the basics. I mean, this is something that has been known all along, but has there been laxity on both part of the government and the citizens recently? You talked about schools. I think most might agree that it was certainly a good idea for schools to reopen. We'd had school closure for far too long, almost 2 years. The longest school closure anywhere in the world happened in India. However, we cannot do away with COVID protocols. I think that is the important point here. Let me go across to Dr. Harsh Mahajan. Dr. Harsh Mahajan, do you agree with Dr. Garg and all those medical experts who said in recent days that it was not a very smart move on part of certain governments, including here in the national capital, to lift certain COVID restrictions that were in place, for example, the mask mandates? In just a few days, you had the DDMA in Delhi almost make a U-turn and say, no, we have to have the mask mandate and violations are going to invite punitive action. I mean, do you think it would have been wiser if we had kept these restrictions in place?
Thank you very much, Neha, for having me on your show. See, the answer to your question is simple, and it's very easy to be wiser after the fact. I think considering the fact that the number of positive COVID cases in the country were around 1,000 in a population of 1.4 billion, of course, there would be undercounting because the number of tests went down. But frankly, at this point of time, we needed to look at the severe cases and those who were getting admitted into hospitals. And if you look at Delhi, there were hardly any admissions that you found in hospitals. And even now, even with the numbers having increased to over 1,000 from about 100 in the last 2 to 3 weeks, we see that hospital admissions are very less. So probably at the point of time that the mask mandate was let go, it may have been, though the government, I would say, did say that even though now there'll be no, fines for not wearing a mask, but yet in closed spaces,
so let's be honest,
gatherings,
we are Indians.
do wear a mask.
We are Indians. Let's be honest. Doesn't work unless you threaten us with a danda.
Yeah, having said that, Neha, I think we saw the devastation that happened last year. It was around the same time that it started. And so I would say that everything is not dependent on the government. We also have to be responsible for our own welfare, for our own selves. And from that point of view, I think the mask should still be worn. Of course, now it's been made mandatory again. But I sincerely feel that it wasn't as if the government went very wrong or something like that. We also need to play our own role. We know, we have seen the devastation. Each family, each, extended family has lost people in the second wave of COVID. And so considering the fact that today more than 80% have, COVID antibodies due to prior infection, supplanted by vaccination. 187 crores is no small feat. And so I think it is the elderly, those who are, having comorbidities, and especially also in the younger lot, we find that the, the Omicron variant, be it the BA.2, be it the XE, be it the BA.2.1, 2.1, all of them have not had severe disease.
Okay.
But in children also, it has been very low, but those who have comorbidities or some other problems, I think those are the people we need to really save from getting severe disease. they should, I think, be allowed to get the precaution dose earlier than 9 months. Some kind of change, I think, needs to be made.
Okay.
We do know that 4 to 6 months after the second dose, at least the neutralizing antibody levels go down.
Absolutely.
The cellular immunity still plays a role and, will create and make those neutralizing antibodies in case of infection. But I think that is where probably, especially with doses lying with us in store,
Exactly.
it is time probably to bring down.
I think the government needs to show much greater flexibility, and Adar Poonawalla has said that repeatedly in recent days. I don't think anybody will dispute that, and thank God for the fact that in recent times the virus has not caused serious disease or hospitalization, but we can all agree there is simply no room for complacency as far as this virus is concerned. Dr. Sameer Gupta, let me come to you now. Now, even as we talk about the precautions that we need to take, there is also some talk of a possible fourth wave. Can't really speculate on that at this point, but I find what Adar Poonawalla has said absolutely staggering. He seems to suggest that in addition to a COVID fatigue that we've been talking about for 2 years now, there may well be a vaccine fatigue across this country. He says the Serum Institute has stopped manufacturing vaccine doses once their stockpile went up to 200 million doses because there just weren't enough takers for these. He says, I even offered to give them away for free to anyone who wanted them because they were going to expire anyway. And then, of course, he goes on to say we cannot afford to put a price tag on the life of a citizen. One will agree with him 100%, but is this your experience and observation as well? That, even though now everyone above the age of 18 can go and get that precautionary or booster dose, there don't seem to be enough takers? Is that your assessment?
Yeah, Neha, so thank you for having me on the show and thank you for talking about this very important topic. I think first of all, let me kind of agree with what my previous speakers have also mentioned, that it's difficult to go back and it's very easy to go back in time and point fingers and say, this is right, this is wrong, and we should have done this or we should have done that. I think a lot of your health is in your own hands. And I'll give you a small example from what I see in my medical practice every day. I still insist that each and every patient of mine whom I see in the clinic wear a mask, and the family members who are accompanying them wear a mask. And I can tell you out of my personal experience, about 75% of them either don't have a mask or the mask is in their pocket, or they've said, you know what, sir, mask gaadi mein pada hua hai. I have left the mask in the car. Let me just get it. And I actually make them go and get the mask. And I remind them that the COVID is not over. So yes, even though the government has not had kind of reduced the mandate, your health is in your own hand. You have to still wear the mask and use common sense. I mean, now it's been 2 years and we've been talking about do gaj ki duri, mask is zaruri, right? I mean, it's been there on every time you make a call and this comes on your ringtone. Coming to the next point about vaccinations, I think India has done so far a fantastic job of vaccination. With a population of 1.4 billion, we have given almost 100 crore people have received the first dose, and about 85 crore people have received the second dose, and about 1.8% have received the booster dose. Now, we do know that your neutralizing antibodies do go down with time, right? Your neutralizing antibodies do go down with time. Your cellular immunity does still have a significant role. But it is important to get the booster. There have been multiple studies across the world that have shown that a booster dose, or the precautionary dose as we're calling it in India, is beneficial. The time frame for that is 9 months in India. However, other countries, they have reduced that time frame from 9 months to about 4 months, 6 months. So, and given the fact that we have a big stockpile of these vaccinations, it may not be a bad idea for the government to reconsider the 9 months and make it more into a shorter duration. Also, with schools opening, we should also get very aggressive on vaccination of children. As of now, I think 66% of children who are 15 to 18 years school-going age group have received the vaccination, and Corbevax has just come up for 12 to 14 years. So it is important for us to vaccinate the children also, because they are the ones who are going to school. And even if they're not going to school, even if they're home, the parents may be going to school. The parents may be going out. So they may get the virus home. They may have a mild infection, but the children may have a little bit more than mild. So it's important for us to kind of get more aggressive on the precautionary dose for sure.
We need to get more aggressive on this, but Dr. Sunila Garg, it just doesn't make sense anymore for the government to still insist that there should be a 9-month gap between the second dose and the third dose that we call the booster dose. When Adar Poonawalla, the CEO of the world's biggest vaccine manufacturer, is saying we've stopped manufacturing more vaccines, we already have stocks of 200 million and there seem to be no takers. Why is the government, and a lot of these are going to expire very soon, why should the government still insist on keeping this gap to the 9-month level, especially given that all doctors have pointed out that neutralizing antibodies certainly reduce over time?
Neha, now there is going to be a discussion on reducing the gap to 6 months. So that is one thing which is going to help us. So you see, it's not that the government is averse to, we are changing with the times, as and when the situation is coming accordingly, with regard to vaccination, our strategy is also changing. And with regard to the precautionary doses also, it is changing, that we will be, bringing down the gap to about 6 months. So that will be important part which you have to remember. And another thing which I would like to point out in context of children, it is important, though the vaccines are available, but it is important that, at the schools or at the children's, side also, the parents and teachers both have to insist on the COVID appropriate behavior. That is number one, because the children also and the parents also should not be under the impression that once after taking the vaccine, they will be protected against the disease. That is another important thing, because the vaccinations are going to, protect us from severe infections and from mortality and all that.
Yes.
So that is where COVID appropriate behavior is one thing which has to be important and which should never have been given up, which is also, and government also, if you will read through the lines, that there will be no fines, but however, people can continue. At the same time, WHO issued the advisory along with Government of India. That is important part which we have to remember. And our population is very diverse. As I think my earlier colleague Dr. Mahajan also pointed out, that, when we talk about this, we have to be very careful. At least spending 4 decades in the field of public health, I can say that, we have to see that the messages translate into action at the grassroots, because they should not be under the impression that the virus has gone away. We are getting very less cases. There are very few hospitalizations, but this is how the pandemic behaves. Primarily it is the cases will come up and down, and the way we are getting mutations also, though you see the mutations are not serious, but they're more transmissible.
They're more transmissible, and that can certainly be said about BA2. Luckily, not causing serious infection or disease, but definitely transmissible. Let me go back to Dr. Harsh Mahajan at this point. Dr. Harsh Mahajan, even as we debate whether the government needs to reduce the gap between the second and the third doses from 9 to 6 months, and that is something that Adar Poonawalla also has made an appeal for, what do you make of the other point that Mr. Poonawalla has made about this vaccine fatigue that seems to have set in? What do you think explains this disinterest in people to come forward and get those life-saving booster precautionary doses? Do you believe that just because we've had a good run over the last few months, and as I keep saying with my fingers crossed, thank God for that, do you believe that people by and large have deluded themselves into believing that the pandemic is over?
This is human nature, Neha, that we've seen, and we've been, giving the vaccination at our center since the beginning. And we've seen that when the cases go down overall, then the number of people coming in for vaccination also goes down proportionately with the reduction of cases. So it does seem that at that point of time, people feel that what is the need for getting vaccinated now? COVID is going. And people somehow tend to forget that, this epidemic, the pandemic, it comes in waves. We've had so many waves over the last 2 years, and we've also always seen waxing and waning. So I think this thinking that I don't need it anymore, I think it's absolutely wrong. We need to be prepared, and it has been shown so very well now that the vaccinated get protected from serious disease, from long COVID, the long-term side effects of COVID, as compared to the unvaccinated. Most of the people going to hospital with the Omicron in the western part of the world, as well as the few numbers that are here in our country, have mostly been those who were unvaccinated. And so we should not forget this. This is information that needs to be hammered in time and time again. And I'm glad that you've taken up this very important issue in your channel. And people should pay heed. And the precaution dose, if the government does reduce the time gap to 6 months or 4 months, I think all those who fall in the category should quickly go and get the precaution dose, because that really helps. And if we are in this good position in India over the last few months, where it seems that Omicron is a very mild infection. Okay, it may be milder than the Delta. It may be more upper respiratory infection as compared to a lung infection. But had this same infection come last year, when we were not vaccinated, when so many of us did not have immunity due to previous infection or hybrid immunity due to a mix of both, we may have seen a very different picture emerge, where many more would have had serious disease and many more would have died. So
Yes.
we need to be very, very cautious and get the precaution dose as early as possible. And needless to say, vaccine does not prevent infection. It may marginally reduce your chance of getting infection, but it saves you from serious disease. It is the mask and
Yes.
COVID-appropriate behavior which prevents infection.
I think
And
it
so
is.
that it's an elementary lesson,
Yes.
which it seems we have still not learned.
We've still not learned 2 years into the pandemic. I'm very glad all of you have come on this show and repeatedly explained the basics to our viewers, that vaccines may not protect you from an infection, but they will save your life. They may even, in fact, prevent your hospitalization or serious disease. That's the whole point. But last word to you, Dr. Sameer Gupta. I don't know if there's any way of frankly convincing the anti-vaxxers, but in recent times, have you had a hard time persuading your patients in general to go ahead and get that precautionary or booster dose? Have you heard many of them say, as Dr. Mahajan pointed out, the pandemic's almost over. Where's the need for another vaccine shot?
Absolutely. So, when you're seeing patients, every time with every patient, I have a discussion that, have you gotten your vaccine? Have you gotten your booster? Where are you in the COVID scenario? And many of them have actually asked that, is the booster dose is the precautionary dose really required? The precautionary dose I thought is a precaution. Do I need that precaution? So instead of calling it a precautionary dose, maybe if we call it a booster dose, there might be a little bit more acceptance, because, when you think precaution, you're like, oh, but I don't need that precaution because I'm fine. I'm healthy. Most of my patients do have heart disease, so by definition, they're not that healthy.
Yes.
But that's a perception in their mind that, I'm not sure if I do need the so-called precautionary dose. Maybe if you call it a booster dose, it may be better.
Okay.
So there is definitely hesitancy. And one more important thing is that right now vaccines are available. Like my previous speakers have also said, there are not many takers for the vaccine. The vaccination drive has actually come down a lot.
And the government needs to do a lot more to focus on that. I mean, if there is a lack of awareness, if people are actually asking questions like, do I need that precautionary dose, then surely there needs to be a fresh awareness campaign around this. And it's interesting you say we should call it a booster dose. Well, the whole world calls it a booster dose. But here in India, we like to do things differently, thoda hatke. So we've chosen to call it precautionary dose. But I think it's about time we educated people and told them that, yes, you do need that third dose. Call it what you like. You need it because it's going to save you. It's going to save your life. And yes, another reminder. COVID is not over, the pandemic is not over yet. So please take all necessary precautions, and yes, it's time to mask up once again. On that note, Dr. Sameer Gupta, Dr. Harsh Mahajan, Dr. Sunila Garg, as always, a pleasure talking to all of you. Thank you for joining us. And thanks to the viewers for watching. It's a wrap.